My name is Christian Bernal, and I studied sports and exercise science. And I started around, I think it's 2013 and finished in 2016. I chose this course because I knew it would give me a career direction that I would be keen on doing and persevering throughout my life. So, if you like exercising or playing a sport, this will be an ideal course for you to take because it's got a lot of benefits and of exposure, not just theory, but also experience too. They will give you experience. Technically, I was supposed to, well, my parents wanted me to do nursing, but um, I end up considering what my my advantages are. So I'm quite good, and I like to do something that's something to do with exercise. And I chose ARU because it was near me, but also I heard a lot of talks that the area in Cambridge, especially for sports science, is a good community to be in and to also to study as well. I've got mates telling me that they've done sports science degree in ARU, telling me that they're really good at like supporting you, giving you achievements, what you want to do at the end. It improved my knowledge, understanding, and actually compassion. They gave me those three aspects of academic values. It just makes you feel like you've got an idea what to do and to not put yourself first, but to put people, others, ideas in order to help you. For example, again, when we see participants, we have to know that can they do the tests if they want to continue or not. And we have to understand, we have to have a compassionate understanding if they want to do it or not. And we can't just push them. We just have to be there for them, really. I definitely developed my time management. And I think knowing how to use your time more efficiently will definitely help you basically what you want to achieve in your life. Um, but also the lectures and staff in ARU, of course, they're very helpful and supportive during the course, but most importantly, your career. They'll try and lead you to it. But yeah, personally, it's mostly time management, really. Main experiences, of course, I did enjoy being a captain for the second team for basketball. That helped me, gain confidence even more. Also, another experience is, presenting in a well-known sports science conference in Bangor, Wales, and yeah, it was a very memorial for me. Like really it's a good achievement for me to um to go back to the past and think about it. Of course, there's a lot of experience that I've done. Like for example, I did a marathon study with you, and that was really nice to get to meet other people, um, the way how they train themselves, and sometimes they even ask us what's the best way to pace, how to pace during a marathon. Yeah, there's a lot of experiences, but the main two experiences that I did enjoy was was being able to present my research study in Bangor, but also uh, be well, yeah, but also being there for your for your course, like for a supervisor. So if you know, it's just nice to help out. It's nice to help out during your course, during your studies. It just challenged me in various ways, such as time management, adapting, being versatile, basically outside of my comfort zone, really. Um, just to become more resilient, and that helped me a lot throughout my career. It gave me like a yeah like a confidence in me that I could actually achieve something great for not just for me but for the community, for the people around me. And knowing those things like that I've done in my course, being able to adapt myself in a difficult situation is a really helpful experience, and that actually helped me out with my career. We did cardiovascular a lecture, just a introduction of it. We looked upon you know what athletes will have, such as left ventricular hypertrophy (LVH), what you will get, how that is bad, and how you can monitor these things. Yeah, so that module really helped me a lot. That scientific basis training. Yeah, what else? Different modules too, like exercise physiology. We get to learn the way how our lungs, you how it works during strenuous exercise, and that is a good um, area to understand first for my career. It actually helped me out with that. Independence, success, motivation, believing in yourself, and teamwork, really. Yeah. I am a trainee clinical scientist specializing in cardiac physiology. My job entails of diagnosing and treatment of patients with heart disease. And obviously, we use equipments and machines for this, but uh, also the knowledge that we've gained while I'm working in the hospital. I have to study as well. I have to finish a degree within cardiac physiology, and that involves you having experience as well with the patient day to day, really, from Monday to Friday. Getting to know them, knowing how well is the patient recovering to have a better, good health and well-being life, and you get to see those things within the degree that I'm doing, um, which is the practitioner training program. And yeah, it gives you an insight not just for athletic population but also clinical population. My degree involves exercise, involves the way how our physiological responses daily living, whether if you're training, whether if it's daily basis. um, and it gave me an insight of how important the cardiovascular and the respiratory system is, um, but not just for clinical population but also athletic population. I was able to feel confident of what's happening on an athlete. So where I work right now in QE, we tend to do tests for footballers, and some of the footballers are really fit. They do a lot of training, but they have to be monitored in such ways because of their heart conditions. So, the degree that I've done in ARU gave gave me like an introduction, but also like a stepping stone, how to handle those um, those athletes, those patients, the patients that we see in daily life. I would say before you choose this field, first try and to do a clinical shadowing in the cardiology department, either at the end of second year or before or during third year, so that you'll be able to know if this is the right field for me. And if you do enjoy it, then I advise you to make sure your research studies within it should relate to the cardiovascular system, because it will help you out once you step into the clinical side of your career. It will help you out dramatically. And or if you want, you could do a postgraduate degree relating, does with cardiovascular. It would definitely help um, undergraduate students to try and get into SDP. It will help them getting into SDP program, the scientist training program for cardiology. But yeah, that's my main advice. Exercise physiology, anything that's with physiology, and also the scientific basis of a training. Those were the key things, but also it's definitely a little bit of biomechanics. So those three modules helped a lot during on my role, because they give you, like I said, an insight of how it works, how the system works, the cardiovascular system works, and the respiratory, but also how to analyze the data that's been given in front of you in your screen, whether if the individuals not fit, not fit to do the tests, or is it if the individual is lacking of effort to push themselves. It's just little things like that from exercise physiology, like VO2 max test. Uh, you get to see how they perform, how their oxygen and carbon dioxide dissociates at the end, during time, really. And those little things, it helps you, well, it helped me how to distinguish what's happening in front of me during my job right now.